In this module, we'll be learning how to perform a point-of-care ultrasound of the leg for deep venous thrombosis. But before we start to do the ultrasound scanning, we need to know the anatomy of the venous system in the leg. So we're going to focus specific areas in the leg. And the first one is the femoral region, and the second one is the popliteal region. So we can start looking at this illustration. This is an illustration of the venous system of the leg. And we will start by identifying the common femoral vein, which is located right here, just below the inguinal ligament. And from this vein, it continues below the leg and bifurcates into two different veins. The first one is the deep femoral vein, which is localized laterally according to the common femoral vein. And the second one is the great saphenous vein, which is the vein located medially for common femoral vein. And from common femoral vein, it continues further below the leg and becomes femoral vein. And from this part, the femoral vein continues just behind the knee and it will become the popliteal vein. And at this level of trifurcation, the popliteal vein becomes three different veins. The first one is the anterior tibial vein, which is localized just anteriorly of the calf leg. And then you have the posterior tibial vein, which is localized posteriorly of the calf. And the last one is the peroneal vein, which is localized laterally in the aspect of the calf. And these three calf veins are pretty small, so it might be difficult to visualize them on the ultrasound examination. And when we do start using the ultrasound, you have to know the difference between an artery and how a vein looks like. So how do you do that? So let's take a further look. At this table here, you can see there are 4 things you can look at. You can look at the wall thickness, because the vein, they have very thin wall thickness compared to the artery, which is more thicker. And there are blood flow through both of them, vein and the artery, but you will see a pulsation in the artery vessel, but the vein doesn't have any pulsation. And if you try to put a compression on the blood vessels, you will see that the vein is really compressible because the wall thickness is really thin. And that's why the artery is less compressible, because the wall thickness is thicker. You can also use color Doppler just to look at the velocity in the vein and the artery. In general, the artery will have a high velocity compared to the vein, which have just a low velocity. And as you can see here, this is a video where you have identified the common femoral vein, which is this one, and this is the great saphenous vein lying medially, and the most laterally blood vessels here is the artery ones. And how can you see that? And as you can see on this video, you can actually see there are some pulsation over here and here, but you don't see any pulsation here or here. And this is typical signs of how an artery and a vein looks like. And then we'll take a closer look how it looks like when you put a color Doppler on the blood vessels. In the artery, you will see there's a high velocity, as you can see here and here. And for the veins, you can see there's a lower velocity. Now you know the difference between a vein from an artery. And now we're going to look further in the leg, how it looks like on the ultrasound screen. So let's start with this here. So when you do the ultrasound examination, we prefer that you use the linear probe. And then the marker of the should be pointing laterally for the patient, just like the illustration here. And we'll be starting identifying common femoral vein. which is just below the inguinal ligament. So how does it look like on the sonoanatomy? So this is the illustration of the sonoanatomy. So here you see the common femoral vein, which is localized medial, and in the lateral part, you see the common femoral artery. Take a closer look how it looks like on the ultrasound. And here's a video that is showing you that. And if we use the signs that you learned previously, how to differentiate a vein from an artery, you see there's some pulsation here, right? And that is an artery. And veins, they don't have any pulsation. If you want to be more sure of what you look at is correct, you can also put a color Doppler, but you can also put a compression on the blood vessels, so you can see if the veins is compressible or not. So we can take a further look here. So now we'll just put a color Doppler over the blood vessels, and you see on the lateral part here, which is the artery, you can see this high velocity there compared to the medial blood vessel, which is a really low velocity here. And this confirms that this is the vein and this is the artery. And then we start moving below the common femoral vein. And the pointer of transducer is still pointing laterally for a patient. So now you see the part where you see the bifurcation from the common femoral vein, where you see the great saphenous vein in the picture. So this is the sonoanatomically illustration at this level. This is the part where you find the Mickey Mouse sign, which is this here. So you can actually see a big head here and two ears here, which makes the Mickey Mouse sign. So the big head is the common femoral vein, and one of the ear that is localized medially at the ultrasound screen is the gray saphenous vein. And the most laterally, or the second ear, is the femoral artery, as you can see. And laterally for the femoral artery, you will also see another artery called the deep femoral artery. And as you can see on this illustration, there are some white things here. Is that a pathology? No, it's not. It's actually just a valve between the veins. So let's take a closer look how it looks like on the video. So here's a video of the Mickey Mouse sign. So here you see the big head and two ears. This big head here is the common femoral vein. And the first ear here, which is localized medially for the common femoral vein, is the great saphenous vein. And as you can see here, there's some white thing here. And as I said earlier, this is the valves between the veins. So it's not a pathology. And then you see there's some pulsation here and here, which confirms for us that this is arteries that you are looking at. So this is the femoral artery, and this is the deep femoral artery. And then let's put some color Doppler on the blood vessels. And here you see really clearly that the artery parts have high velocity, while the veins parts have low velocity. So let's summarize in the femoral region. So start identifying the common femoral vein, and you have to know the difference between the vein and the artery. So use the signs like the wall thickness, the pulsation, is it compressible, and color Doppler to differentiate blood vessels between if it's artery or a vein. So this is a video showing this. And as you can see, here we put some compression on the blood vessels. And because the wall thickness is really thin for veins, when you do a compression with the ultrasound probe, it will make the wall in the veins meet each other like this. And this is normal for a vein. And this compression is really important when you do the ultrasound examination for deep venous thrombosis, because if there's a blood clot there, you won't see it on the ultrasound screen.